Our next presenter comes from Stanford Institute for Human-Centered Artificial Intelligence, Daniel Ho. He's going to be presenting Unbreaking Bureaucracy. Daniel, how are you today?
Good. How are you?
Excellent. Welcome.
Thanks so much for having me. Should I just go ahead and share screen?
Yes, please do.
Okay, great. It's terrific to be able to join such an esteemed group. I'm going to switch gears here a little bit and talk about the public sector. So we rely on the government to tackle the most complex challenges of the day, protecting the vulnerable, the environment, and the public health. But there are such profound challenges that plague government that just the word bureaucracy has become a dirty term. And in part, that is because government increasingly lacks the ability to draw on the kind of cutting edge advances in data science and AI, and I think is particularly behind when it comes to some of the really significant gains that come from high performance computing. To just note a few of the challenges of the public sector. The public sector information systems can be woefully outdated. There was a GAO report written in 2016 that looked across some of the major federal agencies and concluded that about 80% of federal agency budgets were spent to support legacy systems. One of those legacy systems was used by the Department of Defense, which, quote, at that point of time was still using 8-inch floppy disks in a legacy system that coordinates the operational functions of the US nuclear forces. Second is that human capital is lacking. So when New Jersey Governor Murphy held a press conference early on in the pandemic, what he noted was that we need two kinds of people right now. We need healthcare workers and COBOL programmers, because so much of the kind of benefit system was still run on kind of a COBOL system. So many folks went out of retirement to try to help troubleshoot those systems as they were being inundated with claims. And then related to that is just the problem of scale. As Tony Blair said, most of the problems of government come from people being overwhelmed by the size and scale of what they have to do. Here's the file room of a recent a mass adjudication agency as of a few years ago that processed veterans' claims for disability benefits. And government IT modernization to move this all into a digital infrastructure has been challenging, to say the least. I will point you to kind of one historical antecedent here. When a similar problem of scale promised to overwhelm the US government, and that is at the end of World War II, the government was facing a surge of nearly or over 10 million veterans returning overseas after having been in combat. And the kind of one of the main challenges with that set of veterans returning was the requirements for sustained medical care. The sense was that our healthcare system was simply not going to be able to provide the requisite level of care. And one of the genius moves at that point of time was that they issued something known as VA Policy Memorandum Number 2, issued in 1946, which provided the legal framework for how it is that VA hospitals could collaborate with academic medical institutions. That set off a flurry of innovation with this kind of public academic private sort of partnership, leading to innovations like the pacemaker, the CAT scan. 84% of medical schools have entered into this kind of a collaboration. 70% of VA physicians hold university faculty appointments. And as someone who thinks a lot about these kinds of challenges in the public sector, the question we've been asking at the Stanford Reg Lab which stands for the Regulation, Evaluation, and Governance Lab, is why not for government? When the current perception may be that all of the cutting edge innovations in high performance computing and AI are happening off in islands that are separated off by a kind of chasm. We have that model for the public sector. And so what we've been doing with the Reg Lab has been really to build bridges between Stanford and a range of different government agencies, both at the local, state, and at the federal level, to try to really re-envision what the future of government might look like if the public sector could actually take advantage of the cutting edge advances that are being showcased in many of the other talks today. Let me give you 3 examples of that kind of R&D for the public sector. The first comes from the agency that does disability adjudication, the Social Security Administration. And annually, it's an agency that processes upward of 500,000 cases per year. And has had major backlogs in processing these kinds of complex cases. It's been documented through a pretty long-standing literature that it has resulted in pretty major discrepancies in how cases are handled, leading some scholars to call it a form of disability roulette. That is here displayed in the data, where you look at disability award rates, where each dot represents one administrative law judge. Cases are close to randomly assigned within a region. And the disturbing finding here is that it often may matter more who the identity of the judge is than what the facts of the case are. And here, the kind of really amazing public sector innovation came from a guy by the name of Gerald Ray, who was then heading up the Social Security Appeals Council office. And he was blocked by a number of personnel management rules that said that because he was the head of the Appeals Council, he could only hire attorneys, since that's what the Appeals Council did, is it adjudicated cases. And so Gerald Ray figured out a way around this by simply looking for lawyers who also happened to have software engineering skills and data science skills. He hired these people, trained them up to actually learn the system of adjudication, to learn the innards of the legal system. And then, as they got promoted up, started to assign them to other forms of data science. So here was one of the first things that he had them do. He did a simple clustering analysis of the types of cases, because one of the challenges faced by judges is that if cases are just coming in random order, you're crisscrossing one complex area of law to the next. And this form of case clustering allowed you to have a form of micro-specialization, where a judge might decide for the entire week, all knee injury cases, get to know that area of disability law extremely well. And they found that form of clustering both improved case processing time and reduced errors. And then, through a series of investments across a number of years, really started to recapture data, because what the adjudicatory system was doing up until that point of time was largely writing decisions in Word or Word Perfect format, without ever capturing the metadata that could actually enable you to learn and build in systems improvements. And that culminated in what is probably one of the most creative uses of AI in governance to date, which is this system called the Insight system that a fellow by the name of Kurt Glaze developed. And what that Insight system does is it allows judges to upload drafts of their decisions, and then it will process using simple NLP tools those draft decisions and spot anywhere up to 30 potential errors that can be as simple as you've cited a provision of the US code that does not exist, to here is an internal inconsistency in your decision because you've identified this particular functional impairment of the claimant, which is inconsistent with your ultimate legal conclusion as to the claimant's ability to be gainfully employed. So it would look like a flag like this. And what they found through the use of this insight system is that it improved both the accuracy and consistency of this kind of disability adjudication. Our team at the Reg Lab is now engaged in a partnership with the US Department of Labor, really to bring some of these kinds of insights into another complex adjudicatory process using some of the really incredible advances that we've seen in natural language processing over the past few years. Example number 2 comes from environmental sustainability. One of the main sources of water pollution is agriculture, and in particular, these kinds of toxic algal blooms that occur in Lake Erie annually these days are suspected to come in part from these intensive livestock farms. The term of art for these is concentrated animal feeding operations, or CAFOs, that are large industrial scale facilities where a large poultry facility has over 125,000 heads of poultry. A large hog facility has over 2,500 heads of hog. And the worry is that a kind of one large CAFO can produce as much manure as the city of Philadelphia. And in contrast to human waste, there are no kinds of treatment requirements for this kind of waste. It's stored in a kind of outdoor lagoon like this, potentially posing pretty significant environmental harms if this gets into the waterways of the United States. As the Government Accountability Office noted, one of the basic informational challenges in the system has been that no federal agency collects accurate and consistent data on the number, size, and location of CAFOs. And so a number of years back, we started to turn to this problem and really think about taking the deep learning revolution, which of course to date has been used to solve the internet's most pressing problem, to try to distinguish cats, dogs, and birds, to this more socially important environmental problem. And so in a paper that we published a number of years ago, we demonstrated how you could work with an environmental interest group that had actually spent years manually poring over satellite imagery to identify where these CAFOs were located in one state. And we could train a computer vision model to be able to detect and distinguish animal types of these kinds of CAFOs. Here in the left column is a hog CAFO, on the right column is a poultry CAFO, and this is a kind of class activation map of what it is that the model is detecting. And that allows you to take a process that took an environmental interest group on the order of 3.5 years to have humans manually poring over this down to just a few days. And what's even more powerful about this is just in the time that it took a human to kind of review this, we detected 13% more CAFO facilities had been constructed. So there's just a real promise here in terms of being able to automate that kind of detection. Our bet here is that with the near exponential growth in satellite imagery, with the capacity easily to scan the Earth's land surface once a day with a variety of different sensors, that this is the kind of thing that can really fundamentally change the way we do environmental monitoring, where to date, a lot of environmental monitoring is through self-reporting by facilities or by physical inspection, where facilities permitted under the Clean Water Act, for instance, might be visited once every 2 or once every 5 years. And that's the real promise of this kind of technology. Third example of what we might be able to do if we had this kind of R&D for the public sector, comes from COVID response. This is a picture of the health officer of Santa Clara County, who, along with 5 other Bay Area counties, was the first to issue a shelter-in-place order in the country back in March of 2020. One of the really stark dimensions to the pandemic has been the really dramatic disparities in disease incidence. In Santa Clara County, roughly 25% of the population identifies as Latinx. At the time that we really started working together with the county public health department, over half of cases were of Latinx for individuals identifying as Latinx. One of those collaborations that we focused on first really surrounded contact tracing, because within a matter of weeks, the county had stood up a contact tracing workforce of about 1,000 individuals. And worth noting here that there was this paradox in terms of our public health infrastructure, where on the one hand, the public health department of Santa Clara County is at the cutting edge. As Silicon Valley is of course in the heart of Santa Clara County, but at the same time, many case reports were still being faxed in at the beginning of this pandemic. So there were these really profound informational and infrastructure challenges. One of those challenges in contact tracing was that the county received sparse lab reports that really gave you no information other than name, date of birth, and address of individuals in a consistent fashion. The really quite significant concern was that because there was no way to know more about these incoming cases, even though Santa Clara County had hired a group of bilingual contact tracers, there was no way to match them to incoming cases based on language need, thereby posing the risk of exacerbating these kinds of disease disparities through contact tracing. So what we did at the Reg Lab team is we took that lab information, merged it with census and other administrative data, built out a simple algorithm really to predict incoming language needs, and then matched bilingual contact tracers with those cases predicted to have Spanish speaking needs. We wrapped that all in a kind of pilot randomized control trial, which basically showed that reduced the contact tracing time by 14 hours when there are really significant demands to try to get to folks as quickly as possible after they receive a diagnosis, and improved engagement during the interview in a number of different dimensions. To kind of wrap up, and would love questions from this audience. I think in my line of work, what I'm most excited about is the ability to get together interdisciplinary teams of students, faculty across the social sciences, data science, and engineering to tackle these kinds of problems. We also try to generalize from these kinds of deep partnerships with federal agencies. So here's a long report that we compiled for the Administrative Conference of the United States, along with my colleagues David Engstrom at the law school, Kathy Sharkey at NYU, and Tino Cuellar, who was then on the California Supreme Court. That was on the use of AI by federal regulatory agencies. And on the compute side, we recently issued a white paper in response to the call for a national research cloud. And for those of you who may not be as familiar with this initiative, it was put into the NDAA, the National Defense Authorization Act, a year ago. It was initially a call by my colleagues, John Etchemendy and Feifei Li, in recognition of the fact that data and compute are so critical in driving these advances, and that much of the locus of where you can easily access large-scale data sets and compute has moved towards the private sector. And the call for National Research Cloud really is to build system that provides subsidized high performance compute for academics and couples that with access to some of the most valuable data sets that exist in the US, but are inaccessible to most researchers, namely administrative data sets that exist in federal agencies. So happy to talk about those as well. To me, what this is, what makes this fundamentally exciting work is that it's about a kind of future vision of an engaged and impact-oriented Stanford that brings to bear these cutting-edge advances to solve some of the thorniest problems that we face as a country. If you have any questions or are interested in helping out, please feel free to reach out, but I'm happy to take any questions.
Thanks, Daniel. Appreciate the presentation. I do have sort of a two-part question. How have you been able to assist or impact how local governments make use of AI resources for COVID response?
Let me just make sure I understand the question. How have we been able to do this? So I think one of the biggest barriers to the adoption of AI in the public sector generally, but particularly for the states and localities, has been the sort of human capital dimension of it. And so that's, I think, part of this role that we play as a lab is that we, with any of our partners, end up having a series of kind of scoping conversations as to what the most acute needs are, whether AI is part of the potential solution set, and then really co-design interventions. The biggest barrier, particularly in the health space, is that it is, of course, not easy to access health data. And I think that's, going, particularly when we were talking about the pandemic, going through and negotiating on an individual basis, a data use agreement for all different sources of public health data, I think have really slowed down the ability to have meaningful kind of AI collaborations around this space. And so a lot of what we do is we build up these partnerships, figure out how to onboard people onto the data systems. I think there are a lot of important ways in which policies can promote that kind of work. The National Research Cloud being one. The goal is to actually have a more streamlined way of accessing administrative data than the really fragmented, laborious process that folks undergo currently. And with the federal government in particular, there is a really important statute known as the Intergovernmental Personnel Act that allows federal agencies to designate academics to serve as if they are employees of that agency. And there are some agencies who've done extremely well at bringing people in under the Intergovernmental Personnel Act to get to be able to work closely together like that. For many agencies, it's just a no-go to take highly sensitive data and figure out how to transport that over to like a Stanford server. And I think for states and localities, that kind of a vehicle is very much necessary. So in a piece that our health officer, Sarah Cody, and I wrote, we actually advocate for a similar enabling act, both for California and for the rest of the states, that would allow this kind of collaboration. But Brian, I'm not sure if I answered the question directly. Was that sort of what you were getting at?
Yes, and then another one. How have you applied AI to your work, and do you leverage local resources or a cloud?
It really is a mix. So we will both use on-prem options here at Stanford. I think the Population Health Sciences Center has done a really great job when it comes to certain kinds of health data to actually really streamline both the data access, but also have it couple with the high-risk compute environment, because that can be a huge lift. There was one project for the VA where, in the negotiations of the data use agreement, we were building like a custom server to their particular specifications, which are not easy to meet with some of the kind of government specifications. But that I think is a really important part of this in terms of being able to host high risk data. Then in other instances, there are agencies that are just prohibited from doing anything that's really in the cloud at all. And so we work on their kind of on-prem research clusters, and don't bring any of the data over here to Stanford. So it really depends on the specific setting of our government partners.
Understand. Mm-hmm. Thank you. That's the last question I have. Daniel Ho, everyone. Thank you very much, Daniel. Appreciate it.
Thanks so much. Bye-bye.